a new podcast, cutting edge benefits with our host Tom Quigley. Tom, how are you? And appreciate you coming by.
Well, thanks for having me, Neil. How are you?
I'm doing fantastic. What I'm blown away with now on this podcast, we're going to show how companies can be able to save money on their benefits plans and really decrease their bottom line and help the company profit more, right?
Oh, absolutely. It's a huge opportunity for small businesses to increase their value and look like heroes to the employees.
All right, so our topic today is the hidden costs of traditional health insurance and how to cut them. So basically, why do most businesses overpay for health insurance, Tom?
Because they lose focus. They forget the reason they buy health insurance is to transfer risk. And what they don't realize is they're actually giving the insurance company, when they buy office visit copays, drug copays, lower deductibles, they're actually giving the insurance company more money than the actual risk. And it's hidden away in the insurance premium. So they feel like, oh, we pay the premium and we get these benefits. What they don't do is the math. Because if they did the math, they went to the same insurance carrier and went to their highest deductible, got the old calculator out, they'd go, wait a minute, we have a $2,000 risk and we're saving $2,500. So to equate this to real life, you walk into a casino, you put in a slot machine, you hit it for 2,000 bucks, you put 1,000 in your right pocket and then 1,000 on your left, and you only play with what's in your right pocket and you lose it all. You walk out a winner, you have 1,000 bucks. Same with health insurance. You have a $2,000 risk and you're saving 2,500. You're guaranteed to save 500. So if you have a couple employees spend a night or two in the hospital, you only save 500 on them. But the majority do not. You get to keep 2,500. Seems like a bad deal to me. That's what
Absolutely.
everyone's doing.
Yeah. So how does ClaimsLinx help companies save thousands per employee?
So what we do is we manage the plan underneath instead of the insurance company, and we do so with a second insurance card. So you have a primary insurance and a secondary insurance. The secondary insurance is using the money that they save to provide, you can actually provide the employees better benefits. So that's what you do. And what we do is we pay the doctors, hospitals, pharmacies directly, pharmacy at point of service, and the employer pays us once, twice a week, a month actually, um, or they can do it weekly. They can finance it however they want. And what we do is we pay the doctors on their behalf, and we send the employees their explanation of benefits, explaining what they owe. Uh, and then there's all kinds of things they can do that we do that prevent risk, such as manufacturers' rebates, negotiating with hospitals, grants. There's all kinds of things behind the scenes that people just don't realize.
Absolutely, and it's something that is needed. The expense, how expensive is healthcare for companies right now?
Most companies, if you take the total premium, the family rates are more than the average person's mortgage. So I often say, wouldn't it make more sense just to pay for people who work for you their mortgage versus the health insurance? And I've literally had people go, can you write that off? And I just sit there and shake my head. Um, because it's like, well, or you can listen to me and pay 500, 600 a family versus 2,500.
Absolutely. And and being in this industry for so long, you're able to really understand things that a lot of HR directors aren't able to purchase health insurance from other people, right? That's the other big part.
The HR directors should be have no role in the decision making of health insurance. This should be a outside CPA, tax attorney, controller, CFO, owner, president, CEO decisions. The HR plays a role, but their role shouldn't be making the decisions. That's the biggest mistake insurance, group health insurance uh, agents prey on is they get the HR people to like them by taking them to football games and concerts and all kinds of good stuff. I sit there to the owners and say, this is your value of your company. These are your employees that you're hurting by having them pay all this extra money they don't have to. And it's all because math isn't emotional. So why would you have the most emotional person in your company making the decisions? It's not even logical.
You're able to help people in a lot of ways by giving them a step-by-step guide and restructuring their employee benefits by working with you for maximum savings. Isn't that correct?
Absolutely. It's very simple. It's not hard. We call it the simple option solution. Um, all it is basic math. This isn't even tough math. This is just basic math.
Wow. And are these in companies shocked after you work with them and see that? And we're going to have a lot of them on the podcast for sure to talk about.
Takes them about 6 months, 3 to 6 months, and they start going, "Oh my God, this works." And I just say, I tell you, it's math. Similar to investing. People you don't get excited if your investments go up. You don't get too upset if your investments go down. It's over the long haul. It's dollar cost averaging over time that makes you happy at retirement. On health insurance, same way. Some months you might have more claims than others, but the bottom line is if you're saving more than the rest, you can't lose.
And where are some of these hidden costs that kill you, especially working with just purchasing directly?
The drugs are one of the biggest scams going. The hospitals, um, literally, the grants at hospitals. If you call up a hospital prior or after, say you have a surgery and you ask them what's payment in full, a lot of times they'll knock 10, 20% off the bill. They also have grants. So say you have 4 kids, husband, wife, and you're making 80,000 a year or 100,000 a year, you qualify for their grant. So they may cut half of your costs off. They don't tell you about the grants. Some of the hospitals do, most don't. And literally, you can qualify. They put it out on it. If you go to the internet, go to the hospital, you're having surgery, put patient assistant program on Google, and literally it'll fire a bunch of gibberish. And you go look to the bottom line and it says 50% discount, 60% discount. It may be
And you,
worth it.
right. And if you're a business and you're spending too much on healthcare, they definitely need to give you a call. And the reason is because you're going to be able to really get an analysis to see what they're doing.
Absolutely. All we need is a copy of their current bill and plan design or designs that they have. And literally, we go to the same insurance carrier initially and we show them if you're using Blue Cross of whatever, you get to save staying with Blue Cross of whatever. And they simply have never put the puzzle together is the issue because they've never been shown.
Okay. And people can schedule a consultation with you really simply by going where?
To our website, ClaimLinx.com, clicking on setting up a appointment on Calendly with one of our reps or even myself.
And then be able to break that down and specifically see these different things and all this. And you're probably like, people just don't know this is out there, right? It's like once you get on the call with them and show some of this, right?
Yeah, they've never experienced savings like this before because the rates have never been so out of control like this before. So a 20% savings can be millions of dollars for companies or thousands of dollars.
Right. That was a special simulcast of the Neil Haley show in our new podcast, Cutting Edge Benefits with Tom Quigley, guys. Take care.